Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health on the voice of Nassau Community College at 90.3 WHPC. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're going to talk about a topic that is unfortunately becoming a larger national conversation. I'm talking about obesity. A new survey says that 16 states have adult obesity rates of 35% or higher. What can we do to fix the problem? Let's welcome today's guest, Nadine Gracia, who is the president and CEO of Trust for American Health. Nadine, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you very much, Jeanine. It's really a pleasure to be with you.
So first of all, tell me how you're doing in light of the pandemic. Has the virus affected you personally?
Fortunately, I have been healthy through the pandemic, but certainly have had colleagues and friends who have been directly impacted. But I thank you for asking. This is certainly an unprecedented time for our country, and certainly a time for us to come together with regards to supporting each other through what can be such a challenging time.
Indeed. Tell us about you and what Trust for America Health is all about.
Well, let me tell you a little bit about our organization. Trust for America's Health is a nonprofit, nonpartisan public health organization that's located in Washington, D.C. And we promote public policy that will advance and improve optimal health for every person and community. I serve as the president and CEO of the organization. And prior to being at Trust for America's Health, I worked in federal government leading the Office of Minority Health at the U.S. Department of Health and Human Services.
Wonderful. So please tell us about the research that was just released in a study called State of Obesity 2021, Better Policies for a Healthier America. Tell us about that.
Yes, the report that Trust for America's Health has released today, known as the State of Obesity, is the 18th annual report in which we review the obesity rates across the nation and are able to track obesity in the United States. What we see in this year's report is that obesity continues to be a significant public health crisis for our nation, and that in fact, obesity has worsened during the COVID-19 pandemic. As you noted, we see now that 16 states in the country now have adult obesity rates that are at or greater than 35%. And that's up by 4 from 2019. And to put that into an even broader context with regards to the trends, just a little over 2 decades ago, in 2000, there was no state in the country that had an adult obesity rate above 25%.
Well, that's profound. So how is obesity being defined, and what is the difference between obesity and overweight?
So for adults, we define obesity as a body mass index of greater than 30. And for children, we measure the body mass index differently. And so we have it in percentiles. And so obesity is for anything greater than equal to or greater than the 95th percentile, because children have different growth and development through their lives. And the way in which we measure that is really through height and weight. And it's a mathematical calculation with regards to assessing one's body mass index to really tell us about if you're at a healthy weight. So it's not specifically talking about just your size, but really if you are at a healthy weight.
And what would you say are the leading causes of obesity?
You know, obesity is a complex disease and has many factors that contribute to obesity. One, we certainly recognize the importance of having access to affordable and healthy foods and nutritious foods. as well as assuring that there are active and safe places for people to engage in physical activity. We also understand that the built environment, the design of neighborhoods and communities, whether there's walking paths, biking paths, safe routes to school, and ways in which communities can engage in physical activity, that's accessible. When we think about these risks, what we know is that not every community has an equitable opportunity to actually have access to affordable, healthy foods, as well as to engage in physical activity. Yet the consequences of obesity are significant with regards to higher risk of many chronic diseases such as type 2 diabetes and high blood pressure, heart disease, kidney disease, and stroke.
And so how has the COVID-19 pandemic affected these results and how America's overeating?
So what we've found is that really when we look at the impacts of the COVID-19 pandemic, there are both health as well as social and economic impacts, as we all know from this pandemic. And many of the ways in which the pandemic has disrupted really the conditions and factors in which we live, whether it's in our communities and neighborhoods, that those risk factors are similar risk factors to what can contribute to increased weight gain in communities. So, for example, the COVID-19 pandemic has led to increased job loss. And so that's loss of income and an increase in poverty, which can make it more difficult for families to be able to afford healthy and nutritious foods. It's also contributed to food insecurity, where we actually have seen that because of the pandemic, we saw actually that there wasn't a change in the overall food insecurity in the nation. However, in households with children and in households of color, in particular Black and Latino households, which have historically, as in addition to Native American households, have had higher rates of food insecurity, we saw actually that in 2020, food insecurity did increase in those households. In addition to job loss and loss of income, there's also less access to healthy, nutritious school meals due to school closures, and perhaps also less physical activity because places where people will go to actually engage in physical activity, community centers, recreation centers, parks, and gyms had to close during times during the pandemic. And then the increased level of stress and anxiety, which can also change our eating patterns, are contributors. So those very contributors that we've seen with regards to impacting us with regards to social and economic disruption of the COVID-19 pandemic can also be associated with changes in the choices that we can make with regards to having access to healthy eating, as well as the opportunities to engage in physical activity. And then what we also know is that COVID-19 specifically, by having obesity, that actually increases the risk of severe illness, hospitalization, and death from COVID-19.
So we hear terminology like food insecurity, food deserts, and these terms are used. Could you define those for us?
Certainly. So food insecurity is when a household, and it's really measured at the household level, does not have consistent and dependable access to enough food to actually have an active, healthy life, which differs, for example, from hunger, in which that is an individual and it's a sensation of not having food at the time, but that's at the individual level. And so what we have seen is that food insecurity is certainly far too high in the United States. And with the COVID-19 pandemic, concerns of increasing food security, what, as I noted, we found is that actually some data released by the U.S. Department of Agriculture just last week showed that overall food insecurity hadn't changed. But again, there are certain households where it did indeed increase. And still 1 in 10 households experience food insecurity. When we talk about food deserts, we're talking about a definition as well of having access to entities such as grocers, full-service grocery stores, et cetera, where you can get access to what are healthy and nutritious and affordable foods.
Now, I know you say you're from Washington, but I'm curious to find out how New York State ranks in the adult obesity ranking. How do we rank?
So absolutely. For the state of New York, the adult obesity rate for 2020 was 36.3%, which puts New York as the 46th, the number one state having the highest rate of obesity. New York ranked at 46th. And what we also see, though, are in addition to that overall adult obesity rate, we do see the persistence of racial and ethnic disparities as it relates to obesity that happen across the country, and that also need to be addressed.
So I know you talked about food deserts, and what do you think is the cultural overlay as to what is accessible in terms of food and the quality of food and the community's desire for those foods, and how that really predisposes that population for obesity, the desire versus the accessibility?
Well, I think you raise important points about accessibility, availability, and affordability when it comes to food in and of itself. And when we speak to recommendations, for example, about how to address these issues, there is a recognition that there are cultural differences with regards to eating patterns and qualities of food. And when we think about actually designing nutrition standards, taking those types of factors into account is important. And there are educational programs through several of the federal food assistance programs that there's a call for that, to be able to actually address and understand healthy eating and what does that mean in a cultural context. I think the important thing is really being able to meet communities where they are and ensuring that you're delivering messages and education that's culturally as well as linguistically appropriate to understanding cultural food patterns as well as preferences. But what we also see are some disturbing patterns as well, where, for example, if we look at food marketing and unhealthy food marketing, that actually we see, for example, with the fast food industry, that billions are spent on advertising. And if you look at the advertising, that there's actually a disproportionately higher advertising that's marketed to youth of color of unhealthy foods. And that can change what we desire with regards to our foods and what's available in our communities. Similarly, to what's actually accessible in communities, having access to those healthy and nutritious foods. So part of our recommendations in the Trust for America's Health report is one, to disincentivize, businesses being able to utilize and having these tax loopholes. We really need to close these tax loopholes that provide for being able to have unhealthy food advertising, especially to children.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about obesity. A new survey says that 16 states have adult obesity rates 35% or higher. Our guest helping us understand all of this is Nadine Gracia, who is the president and CEO of Trust for America. So we talked a little bit about obesity. How does that lap over to our children in terms of being in school, having access to school lunches? What are our kids being fed? And what can we do about that?
It's an important question. We have actually also seen rising rates of obesity among our children, where from data back in 2017-18, we saw that obesity rates among children were nearly 20%. That's among children between the ages of 2 to 19 years old. And the issue there is again, the health consequences of obesity that also carry an increased risk for children of type 2 diabetes, as well as high blood pressure and even depression. And so addressing obesity, especially because it can have long-term consequences, is critically important amongst our kids. Access to healthy school meals is critically important. And actually, for many children, that may be the only source where they're actually getting those healthy and nutritious meals. And so what we've seen certainly in the COVID-19 pandemic is actually significant federal investment from Congress that's been administered through the federal agencies and also some of the waivers that were instituted to ensure that kids had access to healthy school meals, being able to assure, for example, that schools could provide free school meals to all students, regardless of their income, as well as the school setting. And so one of the recommendations in our Trust for America's Health report is to make healthy school meals for all permanent. We don't want to see children suffer from hunger and food insecurity or the shaming that they may experience because of the stigma, either for receiving free or reduced price school meals, as well as if they have what can be seen as school debt for not being able to pay for specific school meals. So there's an opportunity there to really learn lessons from what we're experiencing now in the pandemic. There's also been improvements with regards to nutrition standards for school meals, and that's a critical way too of assuring healthy and nutritious foods for children. There are other federal nutrition assistance programs such as the Women, Infants, and Children program, as well as the Supplemental Nutrition Assistance programs, all of these being critically important, where the SNAP program, as it's commonly known, is our nation's most important anti-hunger program. And we see that it helps support and reduce not only food insecurity, but also poverty. And that's very important for our children. And so within the context of the pandemic, what's also happened is increase in the SNAP benefits for families. That's vital for our nation's youth to be able to assure that they do not suffer from food insecurity. What we certainly want to see with regards to addressing obesity for kids is that this is going to require really a multi-sector approach. It's not only healthcare and public health, but it's in education, transportation, housing, to assure that kids have the opportunity to live a healthy life. And so that means ensuring that they have investments in active transportation to support safe routes to school so that they can walk or bike to school, that there's investment for physical education in schools so that they have active opportunities to engage in physical activity. This is how we can really work to transform these systems in which we've seen inequities and disparities facing our nation's youth.
So we talked a little bit about Washington and New York. Tell me how this translates into a global issue with obesity. Have we seen this obesity become a global issue? And give me some comparisons in terms of 20 years back versus now. Where have we seen the change and why the change?
So indeed, we have, obesity is indeed a public health concern across many nations across the world. And we in the United States have seen this trend over the past few decades of the rising rates of obesity among adults as well as children. We have to look at factors, as I noted, it's a complex disease. It's not one single factor that causes obesity or that is attributable to obesity. It's looking at the built environment and whether or not the way in which neighborhoods are designed actually promote active engagement, meaning active transportation, whether it's in biking and walking, and assuring for individuals with disabilities that they have the ability to be able to navigate through their neighborhoods. It's looking at the quality of foods, as I mentioned, with regards to the marketing of unhealthy foods. But we also can look at, for example, sugar-sweetened beverages, and where there are now policies, and a policy that we call for is actually taxing sugar-sweetened beverages. And we've seen some examples of where in doing that taxation, it has actually reduced consumption of sugar-sweetened beverages. And you can utilize that tax revenue to be able to actually put that into programs that help benefit the health of an entire community. We can also address this from the standpoint of having safe neighborhoods to engage and play, and recognize that there are far too many communities where it's not safe, not only because there might not be bike paths or walking paths or parks, but also because of concerns of violence in communities where parents may not feel safe having their kids go out to play as they may have in the past. That's what makes this such a multifaceted issue that has to be addressed, but one in which we truly need to increase both our investment as well as the types of policies that we have to address obesity. Currently, when we look at obesity prevention programs, the federal government is an important source with regards to funding to support states to address obesity. And the federal funding for obesity programs through the Centers for Disease Control and Prevention, we must really align our federal investment on to address obesity to the magnitude and scale of this problem. And we're not currently doing that. Right now, the funding for CDC obesity prevention funding can only support 16 states. That funding needs to be increased so that every state and U.S. territory has access to that type of funding to support community engagement, partnership with community and faith-based organizations that are trusted messengers, trusted partners in communities to be able to work with health officials at health departments and others to be able to address some of these longstanding issues as it relates to obesity.
So tell me, are you aware of different types of medications that can help obesity? And what is your take on the surgical options for obesity that are available to help with this?
Well, healthcare and medical care has a role, certainly, with regards to addressing obesity. I'll say for Trust for America's Health, as a public health organization, we focus in what we call upstream prevention, which means we look at how do we create the community conditions that actually promote health and prevent these chronic diseases such as obesity. And so you'll see, for example, with regards to the recommendations that we present in our report, they're really addressing those upstream factors of poverty, of access to healthy and affordable foods, of looking at the built environment and neighborhood design to be able to make the healthy choice the easy choice. But we know, for example, in the healthcare sector, one, it's important to, first of all, have access to health insurance coverage. We still have far too many Americans who do not have access to health insurance coverage to be able to seek care and get the preventive services needed to assure that they also can maintain a healthy weight. There's also a role for the healthcare sector to be able to play with regards to assessing whether there are specific social needs that a family, patients have. So if someone is coming to visit their doctor or other healthcare provider, it's assessing and asking the questions, do they have enough food to meet their household's needs, or are they experiencing food insecurity? Or is there housing instability, which also can increase potentially the risk for overweight and obesity? Is there job loss or other types of social needs that patients have, so that then the healthcare system can actually help to connect to our social services to be able to provide access and resources to help support them with addressing those needs, and then therefore also help to promote healthy eating, to promote physical activity. But we, in particular, Trust for America's Health, really focus on upstream and really trying to address the conditions where other partners will focus more so with regards to medical and surgical options for obesity.
You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about obesity. A new survey says that 16 states have adult obesity rates at 35% or higher. Our guest helping us understand all of this is Nadine Gracia, who is with the Trust for America Health. She is the president and CEO. So I just wanted to add to this the role of the bariatric surgery for the obese patient who is struggling with this disease and feel that there's really no way out. What is your take on bariatric surgery? Is this something that you feel is a viable option for someone who's dealing with obesity?
Yeah, I think with regards to one, as you noted, medical treatment options as well as surgical options such as bariatric surgery, I think the critical points about that is assuring that anyone who wants to consider or is in a position that needs to consider those options is really engagement with their healthcare providers, to assess what the options are, to also assess how there are other supports that can be built in with regards to assuring that they too can have the opportunity for healthy weight. And so we always would encourage the importance really of seeking out the advice and counsel of your healthcare provider to be able to make those types of decisions.
That's great. And what is we talk a lot about the food insecurity. We talk a lot about our role in education. What are your thoughts about that in terms of giving the patient more psychological support, or social support as it is, for step-by-step, day-by-day interventions? And how do I pull from dealing or having this obesity that may be even familial? My mother, and I see it generationally happening. What do I do?
Yes, and I think that's a critical piece about how, for example, the healthcare sector can partner with public health and with social services sectors to be able to address those needs. Because as we stated, there are certainly the actual healthcare needs that hospitals and clinics can be providing to their patients. But there are also these broader, what we call non-medical social needs. As you said, whether it's finding out, for example, if they have food insecurity, being able to connect them to being accessing, for example, food pantry if necessary. If there's housing insecurity and they need stable housing, do they have access, for example, to social workers or other types of social supports to be able to address getting access to healthy and safe housing? Because part of the challenge can be just navigating all of those various things. Mm-hmm. And when you have limited time, mm-hmm. And you may be, trying to make ends meet and trying to assure that you have actual transportation to get to all of these appointments, you know how to make all of the appointments, you're trying to address potentially issues of childcare. It's how we can actually help support navigating those systems. And so the reassuring thing is to say it shouldn't be one system or sector working alone trying to address these issues, but really building on the assets that exist in communities to connect with trusted community organizations, other types of social services organizations that can actually help meet those needs, and whether there's counseling and other types of support systems that a patient may need to help them, to support them if they're dealing with obesity and working to address and attain a healthy weight.
This is so very profound. How can I get involved? What are some steps that I can take if I'm leading even my family or my community? I want to get involved because this is something that I see is very necessary.
One thing we encourage learning more about this issue, as you noted, as we said, how complex of an issue that it is. And we encourage you, please, to feel free to come and visit our website at Trust for America's Health, where you can access the report to learn more about these trends in obesity. And you can access the report at tfah.org. That's tifa.org, where you can access our State of Obesity report. There's also learning more about healthy eating and physical activity. And so engaging in seeing what exists within your communities, whether it's through your local health department or your state health department, as well as community organizations where they engage and have supports and services and programs that may be tailored specifically for your community.
Well, thank you for being here, Nadine Gracia, who is the President and CEO of Trust for America's Health. We hope you stay safe and continue to have a healthy life and career and go forward in the great work that you're doing. Thank you for being our guest today.
Thank you so much for the opportunity.
This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.